I'm Dr. Anna Baranowski, and I want to talk to you about the TSY yoga approach. It's actually a very interesting approach that was developed by David Emerson. It's trauma-sensitive yoga in therapy. It's really bringing the body into treatment, and it's a great approach for those who are trying to get embedded back into their bodies. A lot of people who've experienced trauma understand exactly what this means. Sometimes you just get disconnected in your body, or there are places in your body that hold tension and emotional pain, and you don't move your body, because moving your body or getting in touch with your body creates this feeling of discomfort. So the TSY approach encourages you to move slowly and to get deeply connected with your body. David talks in his book about his own personal loss and how he used to help him recover. I completely understand this because I started practicing yoga when I was only 16 years old, and I did because I had experienced some very difficult things when I was growing up. Not only in terms of what my parents had experienced, but also what I'd experienced personally. And when I got into yoga class, it was an incredibly transformative experience. So I'm particularly interested in the yoga approaches that help people connect slowly with their bodies. It's like you're building a new relationship with yourself. And that's a great starting point in terms of healing and recovery. Now, this is more about learning to be in the ever-present moment with your body, rather than finding something to self-regulate or self-soothe. It's more about getting connected with your body, learning what works, learning what doesn't work, and moving slowly into forms, which is what David calls them, forms that will work for you right now, where you can feel yourself moving into your body. The TSY approach is defined as a combination of physical forms, focused breathing, and purposeful attention, or what I would call the ever-present moment. It's commonly called mindfulness today, in a very purposeful way, getting connected with, rather than simply focusing on self-regulation or finding calm. It's more about developing a relationship with your body. David did some research with Bessel van der Kolk, who is a well-known researcher in the area of trauma and response. And in 2006, they published a study in which a yoga group felt much better. This is using the Emerson approach. They felt much better using this yoga approach than those individuals who were in a dialectical behavioral therapy approach group. So very interesting, because it certainly opens up a new treatment approach for us to consider. So this is really different than trying to understand the feelings in your body, or have a belief, or change your belief, or have new thoughts about what's happening in your body. It's really more about getting connected with, noticing, do you have tightness in your shoulder when you feel that way? What is it like when you stretch your hands? What is it like when you open and close your hands or bend forward? What's the experience like? Is it tolerable? What do you feel in your body in the moment? Would you like to change that posture? So it's really a dialogue that you're having with yourself, with your own body, rather than trying to figure out, is that body sensation associated with a trauma or something that was upsetting for you. In the book, David shows a number of different yoga postures, or as he calls it, forms. I'm going to show you those forms as we go forward and give you a brief description for each one as we proceed. So if you want, you can try each one and listen to my description and notice how you feel. In this seated mountain form, if you like, you might want to experiment with sitting up comfortably tall in your chair. Maybe you could bring your feet to the floor at about hip distance apart with your ankles under your knees. And maybe lengthen slightly up through to the top of your head, and notice if you feel your body lightening up. In this lateral neck stretch, just take a gentle lateral movement from side to side, and if you like, you can gently tilt your head to one side, and when you tilt your head to one side, just allow the muscles on one side of your neck to lengthen. Maybe after a few breaths on one side, you could tilt your head to the other side for a few breaths. And when you tilt your head to one side, just maybe notice a feeling in the side of your neck. Shoulders stretch too. If you like, from a seated mountain form, rotate your entire body about 45 degrees in one direction. Then, if you rotated to your left, you could reach your left arm back around to the right side of the chair. This stretches some of the muscles in the front of your shoulder. Just feel what it feels like to take a few breaths, and then switch sides if you like. In this forward fold, just allow yourself to place your feet a little wider than your hips and fold forward so your fingertips touch either the floor or maybe a pillow or a yoga block if that's more comfortable. And just allow yourself to release forward and notice what you feel as you breathe in and out. You want to consider 3 specific things when you're using TSY approach. The first one is to make everything an invitation instead of a command. 2, you're going to connect choices explicitly to what can be done with the body right now. And 3, connect choices to interoception. Now, I'm going to just define interoception as being in the ever-present moment with your body and learning from the kind of language that your body is sharing with you. Is there pain? Is there comfort? Do you want to switch or change the feeling by moving your body in one way or another? So it's kind of building that intelligence in your body through observation in the ever-present moment.
For more Ask Dr. Anna videos and information about post-traumatic growth and recovery, subscribe and like our YouTube videos at What is PTSD, or join us at previous video episodes in our playlist Ask Dr. Anna from the Traumatology Institute team.